In today's COVID-19 update, we speak with the Honourable Minister of Health, Dr. Frank Anthony, about the ongoing COVID-19 vaccination campaign. Minister Anthony, thank you so much for joining us.
Thank you very much for having me.
All right. Well, as stated, could you give us an update on the rollout of the children vaccination campaign? I know that we're moving to other regions right now.
Over the last couple of days, we've been in Region 4. We started the campaign at St. Stanislaus uh, College, and yesterday we were at St. Joseph Secondary School, and we have had the schools in that area, students from neighboring schools coming as well. I think so far, and of course we have had the drive-through at Movie Town. So far the exercise has been quite good. We've had a number of parents bringing their children to get their vaccination. As of yesterday, those numbers are 2,176 children who would have received at least their first dose of the Pfizer vaccine. We also note that sometimes parents, when they bring their children, they themselves are asking for the vaccine, so I think that's a good thing as well. But so far, I think the rollout has been good. So we'll be operating on the East Coast at Bladen Hall, multilateral school. So persons from the school can come there and get the vaccine, and from neighboring schools as well. And persons from the community who are below the ages of 18, between 18 and 12, maybe some of them are out of school, they can come there as well and get the vaccine. We'll also be on the East Bank at the Diamond Secondary School. And again, schools around there, they can send the children to the Diamond Secondary School, and young people who are out of school but within that age range of just below 18 and 12 can come there and get their vaccination as well. Tomorrow we'll be at Queen's College, and again schools around Queen's College can come out and get their vaccines there. On the 2nd, we'll be at West Demerara Secondary School, and we're also going to be at the Lenora Secondary School tomorrow. And we are going to be at the Greenwich Park Primary School as well. So on the 2nd of September, we'll be more in Region 3. And on the 3rd of September, we are going to be in Region 6. So we'll be at the Quarantine Comprehensive, and we'll be at Berbice High School, and we'll be at Skeldon at Line Path Secondary. So I want parents to note these dates, and hopefully they'll mobilize the children to come out and get their vaccination. So we are getting more cases. Right now we have 1,933 active cases. So that's a high number. We also have, over the last 24 hours, we would have seen 145 active cases, new cases being discovered. And so the numbers are climbing. We are seeing more people getting infected, and it is also very worrying because if we don't manage this carefully, our hospitals can easily become overwhelmed. We can accommodate about 200 persons at Ocean View. We have right now 33 persons in the ICU. And 33. We have capacity for about 40 in the ICU. We are working to expand that so that we can add probably another 10 beds So if it becomes necessary that we'll be able to have 10 more beds so we can accommodate at least 50 persons in the ICU. So that's a contingency that we're putting in place. And if we start getting more patients, we are also looking at a contingency of adding maybe 50 more beds to the Ocean View facility. So it is going to be challenging going forward as we get more and more hospitalization. We have already spoken about other contingencies where we might have, if it becomes necessary, close some of the services at other hospitals and convert those hospitals solely for COVID patients. So if it becomes necessary, that is what we'll have to do. And then, of course, we'll activate the field hospital as well. So we have considered some of the next steps if the cases go up. So we right now have 313,469 persons who have received their first dose. That's about 61.1% of our adult population. And that's fairly good. We need to take it up, but that's fairly good. But when we look at the second dose, it's only 161,022 persons who have received their second dose. No, that's the simple answer. Side effects are things that you would experience for 24 to 72 hours. They include having a little bit of pain at the site of the injection. It might include a little bit of fatigue. It might also include a bit of fever. Some people might get a little bit of weakness, but all of these signs and symptoms would disappear within 24 to 72 hours. So side effects are going to be there because different people would react differently to vaccines. A lot of people would get a vaccine and nothing would go wrong with them. They don't feel anything. And there are others who might have some of these signs and symptoms. So after the time period, maybe of 72 hours, all of that disappears and it's okay. So it's not serious.
Well, that's it for today's COVID-19 update. We just spoke with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and of course our social media platforms.